Last year, United Way provided health care to more than 20,000 low-income people in the Portland-Vancouver area, helped keep more than 7,000 people in their homes rather than on the street, fed more than 40,000 hungry people, and brought child care to more than 7,000 children and families in need. But tallying the numbers doesn't really matter. What matters is you and United Way, working together, changing lives.
Changing lives means parents who have the confidence to be teachers to their own children and who can provide the model for lifelong learning.
Changing lives means people are smiling again.
Changing lives to me is seeing a child after 5 years of stable housing who nobody would have predicted would be a leader, performing well at school, performing well within his family.
Changing lives requires action.
Changing lives means helping just one person.
Changing lives means providing the opportunity for a person to succeed.
Changing lives means no one goes hungry.
Changing lives means bringing out the best in people.
Changing lives is simple. It's just getting involved.
Our two states have ranked very high in hunger, and the four-county area has certainly experienced that hunger over the last few years with the economic downturn. What that means for us is that families are having trouble coming up with enough money in their budget to meet all of their needs. Oftentimes, food is the one area that gets shortchanged because if they don't pay the rent, they're kicked out of their apartment. But the grocer's not there saying, you've got to come spend the money at the store. And that has implications for families, especially for the children in school, in their ability to learn and their ability to succeed as adults.
Access to services is about prevention. It's about helping people before the situation becomes a crisis. If a person has a need and they can get help for that need, then it makes a closer loop between the need and the solution, and people don't fall through the cracks.
Costs to the community of homelessness are great. Schools can't educate children who don't have a stable place to live. Employers can't expect good work from folks who don't have a stable place to live. And healthcare, mental health issues, addiction, relapses, all aspects of stability in people's lives is impacted by lack of decent, ongoing, safe, affordable shelter.
There are many needs in our community for preschoolers. The waiting lists for Head Start are very high. The kindergarten teachers that I talk to are telling me that kindergartners, many of them are coming to school not ready to learn. Parents who've been disenfranchised as children in the school system or immigrant parents from other countries don't understand the expectations of our school system. And these parent education programs and preschool programs with community help and community funding can really make a difference.
For my children, I want them in a great educational program.
I want everyone to have affordable health care regardless of their income level.
I want my family happy and successful.
I would like kids to be able to pursue their dreams, their passions, no matter what their backgrounds are, no matter what race or culture that they come from.
Changing lives to me has two meanings. For the people, for the affluent people, it can change their lives by feeling good about the commitment that they make in the community through United Way. For people who aren't as lucky as I've been in my life, it's an opportunity for them to be successful in the community by benefiting from many of the programs or one of the programs that are funded through United Way.
You may not realize it, but you can make a big difference in people's lives by doing the smallest things. Changing lives is what matters.